Thank you for joining us for our Wednesday COVID-19 briefing as we keep you updated regarding our fight against COVID-19 and the gradual reopening of Tennessee's economy. In 89 of our counties, we see businesses taking the Tennessee Pledge and opening at limited capacity. Restaurants are beginning to open, retail outlets are opening today, and gyms will be opening on Friday. And all the while, we remember that social distancing works. And we remind every Tennessean that continuing social distancing practices like washing your hands frequently, staying home when you're sick, wearing a cloth mask when appropriate, those efforts will ensure that we can stay on track with a safe reopening plan. The Tennessee Pledge asks businesses to provide safe working conditions for their employees and for their customers. And it asks employees to protect themselves and their coworkers as well as the people that they serve. We're giving these businesses very specific and detailed guidelines so they can do just that. And as we see Tennessee businesses adopt the Tennessee Pledge and do right by their customers and by their employees, we want to call them out. Today we're shouting out a couple of businesses that have reopened in a very responsible and safe way. Three Dog Bakery in Mount Juliet, Sprouts Children's Center in Manchester. Thank you for your efforts. Keep up the good work. Companies like yours all across this state are opening up in a way that provides for the safety of Tennesseans and allows us to get our economy started again. During our briefing today, we want to discuss our next steps for expanding our aggressive testing efforts, as well as the next round of guidance that Tennessee businesses can expect to receive. Our case count today is 10,366 confirmed COVID-19 cases in Tennessee. We have tested over 168,000 Tennesseans, and we have lost 195 Tennesseans to COVID-19. Dr. Piercy will share more today during her report about the efforts that we are making to ensure the integrity of our data and measures that are in place to make sure that patients are properly accounted for as we learn more about the movement of this virus every day. I want to talk a bit about testing and our increased efforts to test more Tennesseans. Earlier this week, President Trump announced that states should move to test 2% of their population every month. With almost 170,000 Tennesseans tested already, we have accomplished that goal for April. And now that we turn our eyes to May, we are encouraging Tennesseans to help us meet this goal next month as our aggressive testing effort ensures that we can continue to safely reopen our economy. As more Tennesseans prepare to return to work, especially those going back to work, we encourage you to get tested at your local health department. Your local health departments provide free testing 5 days a week. And for the past 2 weekends, we've also offered drive-through testing sites all across the state. These sites will continue this weekend. You can find the locations of those on our website. And we encourage every Tennessean, regardless of symptoms, to take advantage of this free testing service. Every Tennessean should keep watch on how they're feeling and embrace the motto of when in doubt, get a test. But we're also and especially cognizant of our vulnerable populations, especially and including the elderly. So today we're announcing that in the next several weeks, the Unified Command Group is embarking on widespread testing of all long-term care facilities in Tennessee to help these facilities identify COVID-19 positive patients and staff even more quickly. We have 700 long-term care facilities in our state, and 70,000 of our Tennessee residents are in long-term care facilities. So for this initial push, we're partnering with the National Healthcare Corporation to test all residents and staffs in each of their 38 Tennessee facilities. We thank NHC for their partnership as we work to protect this most vulnerable part of our Tennessee population. And we look forward to working with all long-term care facilities here in Tennessee. The Unified Command Group is also finalizing plans to make testing more widely available especially within the minority community, and we will be sharing more about these efforts in the coming days. Yesterday, I signed Executive Order 30, which is predominantly about reopening our economy in the safest way that we can. In this order, we continue to restrict social gatherings to groups of 10 or fewer. We continue to encourage working from home and staying at home whenever possible, and we encourage the use of social distancing practices like wearing a mask in public places. While we did extend the closure orders for a number of businesses, we included language in this executive order that signals that we're working to open up businesses even if they are on that list for now. The situation there is that we had to issue an updated order yesterday in order to allow retail to open today. But as we said in the order, there are some places that we anticipate opening before the end of May. The first example of this, as you may have heard, is close contact services like salons and barbershops. Today, I'm announcing that close contact services will be opening 1 week from today in 89 of 95 Tennessee counties. We know that for these businesses, things like masks are especially important because of the close contact that employees have with customers. We'll have guidance for these businesses before the end of the week, and we will be asking each of those businesses to take the Tennessee Pledge, just like we have for restaurants, retail, and gyms. Before taking questions, I want to ask Dr. Piercy to come up and share her health report. Dr. Piercy.
Thank you, sir. Good afternoon. Today's case count is 10,366, which is a 3.1% increase since yesterday. You'll also notice that our hospitalization number looks significantly higher today, so I want to give you some context over why we're not surprised by that. Our hospitalization number today is 1,013, which is a 13% increase from yesterday's number of 894. First of all, before we go any further, I want to reassure you that this is not reflective of 119 people suddenly being hospitalized in the last day or two. Rather, it's the result of an enhanced effort to ensure the accuracy of the data we report. I'll also take this opportunity to remind you that even though this feels like it's been going on for a long time, we had our first case 8 weeks ago today. During those 8 weeks, we've been developing checks and balances to confirm the integrity of our data, which is so critically important as we try to understand this novel virus. As a part of our data auditing process, we've recently started cross-checking our data with the ADT feed, that's Admission, Discharge, and Transfer data feed from the Tennessee Hospital Association. We've caught some hospitalizations that were previously unreported. This follows the same process that we've been doing for several weeks now on our death reporting by cross-referencing hospital reports of death with death certificates. Regarding hospitalizations, we're confident in our contact tracing process, but any person in this nation doing contact tracing will tell you that there are some inherent limitations in that process. First of all, we have to call people when they test positive. And even though it sounds simple and it's hard to understand how sometimes we don't get accurate information, it really highlights the importance of people giving us accurate contact information, answering the phone when our staff calls, and giving full and complete responses, including any hospitalizations. We will be cross-referencing this list on a weekly basis going forward to ensure real-time accuracy of our hospitalization numbers. Again, the vast majority of the patients reflected in today's increase are already well and fully recovered. This is simply a reconciliation of data, which will be continued on a forward-going basis. The other newsworthy item that I'd like to cover today was briefly mentioned by the governor, and it's our efforts to expand widespread testing in long-term care facilities. Over the next few weeks, we will be requesting that all long-term care facilities in the state test all of their residents and staff, reporting any positive cases to us. The state will be supporting this expansion in testing by providing any and all necessary supplies to the facilities who may need it, including the swabs, PPE, and even staff to come in and do the testing if they desire. With over 700 licensed long-term care facilities in Tennessee, we realize that this is a huge undertaking with significant implications for our long-term care partners. I want to take this opportunity to again highlight one particularly engaged partner in this effort, NHC. I spoke at length with the NHC CEO, Dr. Steve Flatt, this morning, and he has volunteered all 38 of his Tennessee facilities to be amongst the first to participate in this mass testing effort. In fact, 4 of his facilities are scheduled to test every resident and staff member before this week is over. We applaud the quick and proactive response of the NHC facilities and encourage all other long-term care providers to follow suit in this very important step to protect our most vulnerable Tennesseans.
Thank you, Dr. Piercy. Thank you for every effort that each one of you are making, and we are, in fact, making progress. We have a serious health crisis that exists among us today. We have a tremendous opportunity to address that crisis and at the same time begin to reopen our economy in a way that gets Tennesseans back to work. But it will require that every single one of us continue to do our part, continue to pursue the guidance, continue to pursue getting tested, and continue to pursue staying apart by doing your part by staying apart. So we're grateful for the way Tennesseans have responded and continue to respond. We have a long way to go in this, but we are very encouraged with where we are in our progress today. So we're happy to open up the lines and take questions.
Thank you, Governor. First, we'll go to Jonathan Mattice with the AP. Jonathan, your line is open.
Hey, Governor. Thanks for taking my question. It looks like in the executive order from yesterday, religious services are now allowed, although it's encouraged that services would still be virtual or online. It also says that your Office of Faith-Based and Community Initiatives is issuing some sort of guidance. Can you talk a little bit about that? What is your guidance on in-person services for churches and weddings and funerals and that sort of thing?
Yeah. Well, it's important to remember and know that church services have never been closed, even through the first level of executive order. First Amendment rights are incredibly important, and we have worked with faith leaders all across the state to encourage, and I want to applaud the efforts of churches all across Tennessee to find alternative ways to meet and to worship and to serve and to communicate with their congregations and with the people that they are in connection with. The faith community is incredibly important, even more so in the midst of crisis, and we want all churches to remember that. We will be issuing guidance by the end of the week regarding best practices for operating in this COVID environment. We continue to encourage churches to utilize alternative ways, drive-in services, online services, but we will also continue and provide them additional guidance so they have a better understanding of what the weeks ahead can look like.
Thank you.
Thank you.
Next, we'll go to Joel Ebert with the Tennessean. Joel, your line is open.
Yeah, this might be better for Dr. Piercy, but I'm trying to understand the latest death count went up, I believe 7 since yesterday. You said that the hospitalization numbers increased due to just sort of more reporting that you guys got. Was that increase in deaths due to just literally people that died in the last day, or is that due to reporting?
The death count has been pretty stable, and you'll see just sort of typical increases of a handful of new numbers recorded each day. That has been easier to confirm and cross-check that I referenced a few minutes ago because we have the death certificate data. Now, the thing that you have to remember about death certificate data is that is the last piece of information typically that we get on deaths. We'll get notified first typically by a hospital, that there is a suspected death due to COVID-19. and then it takes several days. And I know a lot of people have had to deal with the process of going through the certification and getting a death certificate after a loved one has passed. And so you know that it takes several days to do that. And so once that death certificate data comes in, we cross-reference that with the reports of deaths that we have, and that's how the death reporting is done. You will oftentimes see that family reports or facility reports will come out much sooner because our death certificate data is delayed for typically a couple of weeks.
And then a follow-up. Earlier this month, the CDC recommended that states include probable COVID-19 death cases. Tennessee has not done that for some reason. Can you explain that decision, and will that change?
Yeah, we actually do track that because we track all of our data just like the CDC has. And in fact, in some instances, and I actually think you and I have had this conversation, Joel, that we do things even more specifically than the CDC requires. What I'm specifically referencing is age range. We report it in 10-year bands. The CDC reports it like, I think, 18 to 49 and maybe 49 to 65. But we have the CDC standard and sometimes even more stringent in certain areas. Related to probable or suspected cases, that's kind of a mixed bag because some of those pan out to be actual cases and some of them don't. We collect that information and have actually had significant discussion on whether or not to post that information. Have no problem doing it. We just don't see that it adds a lot of value until we actually have a confirmed case or not. I'll tell you that probable or suspected cases were a lot more, that was a lot more important data point when we didn't have widespread testing. And now that we have widespread testing availability, I'd much rather you have a test and me know positive or negative versus calling you suspected or probable.
Well, why not release that probable amount as what the CDC is recommending? And do you fear that the state's count right now is under what it really is, what the actual death count is?
We're happy to release the probable statistic. We're going to have to give a lot of context on what that is and how people should interpret that. We don't have any problem releasing that. In fact, we've discussed that several times. And no, to answer your question, I don't have suspicion that our case count is off.
Thank you.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Good afternoon, Governor. Did you anticipate such an outcry from hair salons and the like to reopen this soon? And how do you make sure that it's done safely? What kind of enforcement or overseeing that will you have?
I think any Tennessean that is not working right now because of COVID-19 is hoping to go back to work as soon as possible. And any business owner that has had their business closed as a result of COVID-19 is very hopeful that they will be allowed to go back and open their businesses again. So it never surprises me that people want to go back to work or that they want to reopen their businesses. And it doesn't surprise me either that they want that to be done in a safe way. Our economic recovery group has worked with industry groups that are representing those businesses. They want guidance, they want guidelines, they want real clear tools that they can use to open safely because they know that if their businesses are open safely and that we can give them information about how to do that, they know that if they open those businesses safely, then they're more likely to have customers. So I'm very encouraged by the way the economic recovery group has worked with industry groups in particular and the medical community to make sure that our guidance is very clear, it's very detailed. We have taken the time to develop the right guidance for these industries, and because of that, that's why we are certain that they'll be able to open safely.
Just follow up, that information, that guidance will be exactly where and when? I'm assuming it'll be on your website.
It'll be on our web. Right. It's not there. The close contact businesses guidance that'll be developed, and we'll have that by the end of the week, and it'll be on our website, and we will actually push it out to industry groups. We're using industry organizations to push that guidance out as well. We want every company, every business to understand fully what that is, because we know that they want to comply with that in order to open safely.
Thank you, Governor.
Yes, sir.
Next, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
Thanks. Governor, in terms of getting back to the nursing homes, so NHC has stepped up. What about Life Care Centers, which is based in Cleveland and had issues in Washington State? You'd think that having the experience that they had in Washington State, now the experience they're having in Athens, that they would have been more than happy to step up to participate early.
Dr. Pierce, you want to?
So in fairness to Life Care, this has just been a discussion that's been over the last few hours. We've spoken with the association that represents the long-term care facility industry, but we have not yet spoken to all of the different provider franchises or independent providers. Life Care in Athens specifically was very welcoming and compliant when we asked them to test all of their residents and staff just in the last day or two. And so I don't have any reason to believe that they wouldn't be. That's just a function of us not having made contact yet. So I'm not suggesting that they are not volunteering to do that.
All right, thank you.
Next, we'll go to Chris Davis with News Channel 5. Chris, your line is open.
Good afternoon, Governor Lee. You have said that reopening decisions will be data-driven, yet many state lawmakers have posted on social media today about how they reached out to you with constituent concerns over hair salons opening back up, and that you've listened and potentially decided based off those concerns. How big of a factor did constituent concerns play into this decision to reopen salons, and what's the data that you're looking at to determine why they can go ahead and open up next week?
We've been watching data, as you know, since the beginning of this. We looked specifically at the downward trend of day-over-day cases. We've talked about that at length. We've looked at the downward and continued downward trend of positivity rates in our state. We have matched that with the increased testing capacity. As was noted earlier, the amount of testing required in order to get 2% of your population tested in a single month. We certainly have considered the fact that there are 400,000 Tennesseans out of work, as we consider all the data points that weigh into a decision to open up businesses. These are a few of multiple pieces of information and data that we look at every single day. One of the most important ones is our hospital capacity, our healthcare capacity, the amount of PPE that we have available, and our access to the opening of the supply chain. We track that every single day through TEMA, and we push out purchases of that personal protective equipment to all 95 counties on a regular basis. We've shipped hundreds of those out. So we keep track of that supply chain of PPE. All of those things have weighed into the decision of when and how to open which businesses.
Next, we'll go to Shannon Sharp with WTVC. Shannon, your line is open.
Governor, I know that Andy mentioned the Life Care Center of Athens, but now that they've had 2 deaths and 70 other positive cases between residents and staff, does this concern you as much as the Gallatin nursing home outbreak?
Anytime we have an outbreak, we're concerned. And that's the reason that that's the reason we've required long-term care facilities to provide notification to us as soon as they have cases. 2 or more cases. It's why we, within 12 hours, are in that facility working with them to develop an assessment of that facility. And then it's why we have created a measurement by which we will use to do mass testing in any facility that we find a multitude of cases relative to their population. So we're always concerned, we're most concerned, in fact, about our most vulnerable population, and that's the elderly, which is exactly why we have announced even today this strategy to do testing in every single of our 700 long-term care facilities across the state. So we do have concerns anytime there's an outbreak.
And just quickly to follow up, I know I asked this on Monday, but are there any plans to update the Friday numbers on nursing homes any sooner than once a week, or is it still just staying at once a week?
Dr. Pierce, you want to address that?
It's really just a matter of utility. It takes several days to, once we identify somebody needs testing, we get the test results back and post it. There's no reason we can't. The numbers just don't change very much on a day-to-day basis. But the short answer is there's no reason we can't post it every day.
Next, we'll go to Kara Hartnett with the Nashville Post. Kara, your line is open.
Hi, thank you for taking questions. If we see an upward trend in cases or the infection rate over the next week, are you considering backtracking on some of the reopenings that have been announced?
You know, I think I've said all along that nothing's ever off the table, but I also have said that we watch trends, and trends are not normally found within a few days. We've seen, for example, we've seen days where we had an uptick in numbers relative to day-to-day percentage increases. Oftentimes those are connected to a targeted population. Last week, for example, I think we had about 600 positive tests out of the prison system, and that creates a large number for a couple of days. That is not particularly reflective of what's happening in the general population. So what we will do if we see increases in numbers is actually analyze those to determine just where they are, where they're coming from, if they in fact are indicative of something that's happened in the general population, and then make decisions as a result of that.
Well, why aren't we looking at how these first phases of reopening are affecting these metrics before making these additional decisions?
Well, we don't know what impact opening will have on these numbers. We believe and we feel confident that opening safely will mitigate the spread of this virus, and that we can in fact open safely and manage the spread of COVID at the same time. That's why we have used data to make the decisions, and that's why we believe that the decision only to open with very strict guidelines and principles and tools for businesses to open in an entirely different way than they were operating before will allow us to get our economy moving again without undue risk to the public. So that's the movement forward, but we're going to watch data every single day.
Okay, thank you.
Thank you.
Next, we'll go to Sam Zern with WPLN. Sam, your line is open.
Good afternoon. I'm wondering what changed from yesterday's guidance to today's guidance with regards to close contact businesses, and why that revision to Executive Order 30 happened. And on a different note, is there any interest in widespread testing for prisons?
I'll address Executive Order 30 first. So that order was made because we had businesses that would be closing. In order to open retail today, we had to update that executive order yesterday. That order had to be made in order for the retail businesses to open today. And the order extended through the end of May, but it specifically stated that it allowed for continued opening of additional businesses. It stated the businesses that were closed with the understanding that we would be allowed to and would anticipate, frankly, and we knew actually when we wrote that order that we were going to be opening additional businesses, specifically close contact businesses. We had planned to announce those tomorrow, but we did that today instead. We've gotten guidance that let us know that we'd be able to open them in the middle of the week. We'll complete and publish that data on Friday, and that's how that all occurred. Oh, and your second question about widespread prisons, I'll let Dr. Piercy address that.
So prisons are certainly another population that we're very concerned about. They are a contained population where people can spread infection amongst themselves very easily. And so that's something that we've kept a close eye on. The governor mentioned that we did do widespread testing of the Bledsoe facility several days ago, and that there has also been widespread testing of the Trousdale facility earlier this week. We have what I call a tiered approach to prison testing, and we benchmark that, or I benchmark that against what my peers in other states are doing. You've probably heard me reference before that once a week I'm on a call with all of the southern state health officials. Our approach is consistent with theirs, and then I've reached out to some of my colleagues outside of the southeastern United States to see what they're doing. And with minor variation, most everybody's taken the same approach. And that approach is when you have a case or a suspected case, you do sort of expanded testing of contacts and anybody else that might be symptomatic. But as soon as that number grows, or if at any time you recognize a case that isn't linked to the first one, almost akin to community transmission, then we institute the next tier, which is essentially a unit-based or a much more wider spread of testing. That typically involves anywhere from 300 to 500 folks, at least in our prison system. And then if the percentage positivity in that is reflective of a bigger problem, we're very quick to flip the switch and do widespread testing of the facility as a whole. The good news is we have only had to do that mass population testing in 2 facilities now. We have done widespread unit-based testing, so about 400, 500 people in several other facilities, and their positive percentage rate has been pretty low, which is exactly what we want to see. But we do have that tiered system, which is consistent with how our peer states are approaching it.
Thank you.
That's all the time we have for questions today, Governor, if you'd like to make a closing statement.
Thanks again for joining us. We want to do this every day to provide as much information as possible about how we're attacking COVID-19, the efforts that we're making, the progress that we're making, the continued work that will last into the future. We are in a new place in that we are beginning to open up businesses, and we're doing so in a safe way. But the only way that we will continue to be able to do this and to continue to be able to keep Tennesseans safe is if you continue to do your part and stay apart. Thank you.